My name is Ashley Klein-Jimenez. I am with PreventConnect and the California Coalition Against Sexual Assault. You are joining us for our web conference today on state action planning to prevent sexual and intimate partner violence. PreventConnect is a national project of the California Coalition Against Sexual Assault, sponsored by the U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the U.S. government, CDC, or CalCASA. All right, so we have a couple of objectives that we will be trying to check off today as we go through this conversation. So we have a wonderful group of guests who will be describing some opportunities and challenges for long-term sustainable state action planning. We'll be thinking about, who are the potential partners for state action planning that we can identify beyond kind of those usual partners and shared funders that often are part of our teams, and then engage in a discussion about how do we keep partners engaged through state action planning processes. So those are our objectives today. And so just to start off with, before we hand it over and hear from our guests, coalition building and state level coordination and action planning can be really beneficial in scaling up our prevention efforts and being able to increase impact, particularly at the community level. And so we can look at CDC's Connecting the Dots report, and this is an image of that. If you're not familiar with Connecting the Dots, I imagine that most of you are, but if you're not, I will put a link in the text chat in just a minute. I really encourage you to take a look at that, because one thing that Connecting the Dots tells us is it helps us see and understand really how important it is to connect different forms of violence prevention using shared risk and protective factors. And Tori, if you move to the next slide, we also know from CDC's technical packages, and particularly we're pointing to the Stop SV technical package and the intimate partner violence across the lifespan technical package, that there's really a need for multi-sector involvement to be able to have the biggest impact across violence types. And so you'll see here that these are just some of the sector involvements that allow us to have a bigger impact. And I would say, like I said a few minutes ago, multi-sector involvement and action planning around prevention is not just relegated to state level efforts. Local programs can really benefit from coalition building and action planning as well. And I'm not great at multitasking suddenly at this stage in my life, but I will put those links for you in a moment. This is another resource from our colleagues at Prevention Institute, really looking at multi-sector partnerships for preventing violence. And some of you may be familiar with using, thank you, Alejandra. It's nice to have friends who can help you out. This really looks at using a collaboration multiplier to look at who do you collaborate with? Who are the folks that you need to be engaging in your violence prevention work and planning? So that's another really great resource that kind of explains the benefits of collaboration and coalition building in a very easy to understand way. But what may be more easy to understand is actually hearing from people who are doing that. So we're going to go ahead and get to our guests. While we do that, I'd love to know how you are incorporating coalition building into your current work. If this is something that you're doing right now to prevent sexual and intimate partner violence, what does that coalition building look like? Who are your partners? How are you doing it? How are you incorporating that into your planning? And if you're not doing that already, that's okay too, right? We're all on our own path, and prevention is a path. So feel free to let us know that as well. But if you would head over to the text chat and respond with your thoughts around this question, that would be fabulous. And as you do, I'll be kind of looking through what you all are saying. But I do want to introduce you to our guests and let you know that the structure for today is we'll be Tori and I are going to kind of share facilitation roles as we talk with this awesome panel of guests. So I want to introduce you to Alejandra Aguilar. Alejandra is with the California Partnership to End Domestic Violence. We also have Enrica Bertoldo, who is the RPE Program Coordinator for the California Department of Public Health. I'm really excited to be joined by Elena Costa. Elena is working with the Essentials for Childhood program, also at the California Department of Public Health. We have one of my colleagues at Cal Costa, Sarah Orton. Sarah works in our RPE program. I'm excited to welcome Jenya Cassidy. Jenya is with the California Work and Family Coalition. And then we have Kristen Herman. Kristen is the Director of Prevention at the Pennsylvania Coalition Against Domestic Violence. And Jackie Strom is the Prevention and Resource Coordinator at the Pennsylvania Coalition Against Rape. So we will be hearing from all of these wonderful people as we go through this web conference today. But at this point, Tori, I'm going to go ahead and pass it over to you so we can hear from our friends in California.
Great. Thanks, Ashley. And thanks to folks who have been responding to the question in the text chat. I see a lot of people are talking about all the different organizations and sectors that they're engaging with in state action planning. So pretty exciting responses happening there. We want to hear about what this looks like in California. And so to start off, I want to ask Enrica, we want to hear about the RPE State Action Plan for California. Can you describe what that process was like and who was involved?
Sure. Hi, everyone. I'm Enrica Bertoldo with the California Department of Public Health, Injury and Violence Prevention Branch, and I'm the RPE coordinator. I just want to say thank you for having us share and highlight our work in California that we're doing related to state action planning and coalition building. And I just want to apologize that I'm not on video today. I've been very ill the last several days, so pardon me if you hear me cough. But I wanted to start first by providing some context on our different violence prevention programs that are housed in our Injury and Violence Prevention branch, where my colleague Elena and I sit. We focus on the primary prevention of sexual violence, domestic violence, teen dating violence, child maltreatment, and adverse childhood experiences through the programs that are listed here on this slide. Because we do have close proximity to each other, we're able to leverage our work, including other department divisions that address violence prevention.
And this is Elena Costa, and I just echo Enrica just in my gratitude for being able to share some space with you all this morning and talk more about the Department of Public Health and the Injury and Violence Prevention branch specifically. And as Enrica was mentioning, we really focus on addressing violence as a public health issue. We really believe that violence can be prevented, and we do that through a public health approach and thinking through primary prevention and population-based strategies. And also really instrumental is a community-based approach that thinks through how we can address social norms and utilize evidence and data to get there. Next slide.
Okay, since California has the RPE and Essentials and the Delta Impact programs, we wanted just to show a snapshot of our 3 state action plans and their primary strategies. There are some common focus areas and approaches across the plans that you might see here. And keep in mind that this does not represent all the comprehensive work that's taking place to support these plans. So I'm going to talk a little bit about RPE, our focus right now. Our strategies center around promoting social norms and creating protective environments through community mobilization, gender equity, also mobilizing men and boys, healthy relationships, and bystander approaches. Currently, we fund 24 rape crisis centers throughout the state to change school or community policy, norms, or conditions. Both RPE and Delta have some common strategies, such as shifting boundaries and coaching boys into men. So it's important to coordinate our efforts. And right now, one of our developing priorities for RPE is really around empowering women and girls by strengthening leadership and opportunities, which we also see as linked to economic empowerment and educational empowerment. Elena?
Yeah, and Essentials for Childhood Initiative is really lucky to be seated just so close to RPE because it allows for us to have this tremendous overlap on where there are efforts have synergy and where there are opportunities for collaboration. And for Essentials, our focus, two primary focus areas is to promote social norm change and to strengthen economic supports. And we're really thinking about how policy systems and environmental change can help children and families in California achieve safe, stable, nurturing relationships and environments. And in order to do that, we really kind of consider where there are activities that support California's efforts to become a more trauma-informed, resilient state with specifically organizational policies or other activities that help folks move towards that social norm change. And then as far as strengthening economic supports go, there's an emphasis for us on paid family leave and as well as Cal EITC, which is the California Earned Income Tax Credit. And this, I think, is tremendously helpful because of our relationship also with Genya and also and Alejandra's work as well around paid family leave. So I do really appreciate that. Those pieces allow for us to have additional opportunities to move our work forward collaboratively. And Enrica, did you want to talk about our partnership with Delta Impact?
Sure. So I know Alejandra is going to speak a little bit more about Delta Impact later in the presentation, but we coordinate a lot of our activities or training and technical assistance. As I mentioned, we have some common strategies here that Elena and I both mentioned. Okay, next. I'm just going to talk a little bit about our approach for the RPE State Action Plan. The next slide, please. So our approach was really to try to align and leverage efforts to impact shared risk and protective factors for sexual and domestic violence and teen dating violence and child maltreatment. As the RPE coordinator, I do understand that it's important to have a lens of connecting the dots among our programs rather than working in silos. I often think about when I was a counselor working with children and families, they didn't experience different forms of violence as silos. So we need to make an effort to coordinate because we do know there's common causes and outcomes to various types of trauma. So our process really started by using existing groups to collaborate with partners who are already meeting and to be able to identify new partners from there. We have an ongoing RPE advisory group that helps shape the development of our state action plan. We have a state level collaborative that also meets, and I'll talk a little bit more in detail about that. Delta Impact has a very great leadership team of partners as well, Essentials. Elena has built a really strong coalition of partners. So I would say that the added value to doing the state action planning was really to be able to leverage these partnerships who also share a common agenda and be able to identify some of those gaps and opportunities. So we also tried to coordinate data collection, so we're not each independently conducting our own surveys. We know that everyone is survey fatigued. RPE and Delta, we work together to conduct a prevention baseline assessment survey to help inform both of our state action plans. And in the future, we're really hoping that we'll look at data and indicators for shared risk and protective factors. We also coordinated our action plans because, we all each have our own action plans so that they can align where possible. And we also want to be able to leverage our relationships with our partners who are working on common policy areas For example, all of us, want to prioritize violence prevention in the state. We're all interested in working on trauma-informed policies and practices, and we're all interested in integrating prevention among agencies. And we also made an effort to coordinate all of our trainings and evaluation. I know our RPE evaluator has coordinated with both Essentials and Delta Impact on their evaluation plan. Next. So here's a list of our key partners for RPE. This is really not an all-inclusive list, as we also collaborate with other groups who are working on, adolescent health and adolescent sexual health. But some of the partner activities that I wanted to highlight are, for example, with Delta Impact, as I mentioned, we have a shared strategy of shifting boundaries. Over the years, CDPH had worked closely with Nan Stein on how we implement and evaluate it in California. So we shared our tools and resources, such as our implementation and evaluation plan. And for Essentials for Childhood, which you'll hear more about from Elena, we participate in the various coalition and subcommittee meetings to address common areas and learn more on how RPE can support those efforts.
Thank you. So now I'll share just briefly about Essentials for Childhood. I know that there's maybe a lot of familiarity here for folks with RPE and Delta Impact, but maybe not as much around Essentials for Childhood initiative. So I did want to share just really briefly our mission and vision, which is that we're intending to just support and participate in mutually reinforcing activities and strategies across multiple agencies and stakeholders. And I think that really is at the core of what Essentials is, which is a statewide coalition that's seeking to find where there are ways that coming together can help to create safe, stable, nurturing relationships and environments for children and families. And we just know that we simply cannot get there without each other. We're also funded by this CDC, and we're looking truly at addressing upstream social determinants of health to reduce and prevent child maltreatment and ACEs as well. We really have this emphasis that is running through the need to do our work in a collaborative manner. And so there are about 70 different organizations from state and local government, nonprofit, philanthropic organizations that are engaged in our work. And that's about 135 members or so. And all of these folks are coming together to focus on the conditions that put children and families at risk of child maltreatment, and we want to prevent it before it's happening. We also have a strong emphasis on utilizing data and best practices to inform those actions and solutions that folks raise up. And then the staff, actually the next slide probably would be helpful if you wouldn't mind terribly. The staff work on behalf of this organizational structure that you see in front of you. So we have a backbone agency. The two backbone agencies are the California Department of Public Health and the California Department of Social Services. And the coalition itself is comprised of the 135 folks-ish that I spoke about, or 70 organizations. But the work really is happening within subcommittees that are focused on certain topic areas. And then they have created a scope of work for the staff, and then the staff works their scope of work. And so all of those pieces and components are what populate our state action plan and help us to get closer to the efforts that you'll see on the next slide. Which is about the approach. And probably what I have to share will be very similar to what Enrica shared as far as the approach to the state action plan, that the way that Essentials is working in this model. Just like Enrica shared, we are really started off with engaging the current and members that had participated previously in the first funding cycle of Essentials work, and then sincere energy to engage new partners. And we did that through things like ad hoc subcommittees and et cetera, in order to inform the plan. And we'll continue to do that through 2023 as well for this funding cycle. We also, just like Enrica shared, are really interested in having shared data collection activities and efforts, and are always seeking to improve that process and to be better aligned. with our state action plans and seeking opportunities with others to support education on common policy efforts that improve child well-being. I think just like Enrica, had an emphasis on coordinating trainings and thinking about evaluation, not in a silo, but in this more cohesive manner with stakeholders and partners, because ultimately we're seeking, just like RPE, to impact our shared risk and protective factors, because there's just these things don't happen in a silo, as Enrica mentioned. I think I'm going to turn it back to Enrica now to talk about some of our examples of some ways that we've done this as an output or maybe that illustrates this in a better way. Or I can do this.
I was going to jump in and say, Enrica, if you're talking, you're on mute.
Sorry about that. I think Elena is going to give our first example.
Oh, yes. Thank you. So the first example that we have to share is about an activity or a project that we took on. So in our state of California, every local educational agency has a requirement to complete a local control accountability plan. And some folks might think of this as a general plan. It's very similar, except it's for the local educational agency, or the LEA. And so we started working on a policy toolkit that explains to folks working in public health and child serving systems how they can engage in that policy making space to create change for the school community. The benefit at working at this policy level is, depending on where you are at in our state, the engaging in that space can create change for potentially thousands of children. So we were really excited about this as an opportunity to explain how this all works and how one might engage in that space. And so our effort was really focused on identifying trauma-informed practices and approaches that are useful for youth in the school community. And we did that in partnership with the Trauma-Informed Practices Subcommittee to work through that, and also the Policy Subcommittee. But we really could not have done that alone, obviously. And so I think that the emphasis was really on recommendations for best practices for engagement. And there was a really strong effort to make sure that we were engaging with public health programs such like tobacco and oral health, nutrition, education, and also RPE and teen dating violence and our violence prevention initiative friends to consumer test this product and give feedback. Essentials doesn't have funds to work at a local level, but given that our shared risk and protective factors are the same, there's benefits to all to consider where there are overlap to be able to better tell our story collectively or cohesively to decision makers around what change could look like to improve the school community climate. And then I think perhaps Enrique could share about the collaborative.
Sure. So another example that we wanted to highlight is our state level collaborative, which we coordinate through an agreement with the California Governor's Office of Emergency Services. They are the primary funder for victim services here in California. So our collaborative includes representatives from the two statewide coalitions, CalCASA and the partnership, and then also two state government agencies, which is Office of Emergency Services and Public Health. And really the goal here is to align, to act and align strategically in our state level prevention efforts. This group initially went through a strategic process back, maybe 3 or 4 years ago to develop an action plan. And so we see this as the foundation to coordinated efforts that later emerge in our current state action plans. And ways that we align include more intentional coordination of trainings and our state action plans. We also explore how all of us can prioritize support for prevention in marginalized communities, especially when there's new funding opportunities. We also want to leverage our resources for both funded and unfunded agencies throughout the state, because we are interested in building capacity of those agencies that are not currently receiving funding for prevention. And we also want to strengthen our data collection, analysis, and sharing. Next. And another example of where we've collaborated across our different programs is around framing primary prevention of violence. So through our Violence Prevention Initiative, our RPE, or Domestic Violence and Essentials, right now we're collaborating on some message framing templates for overarching topic areas. And those topics are around creating protective environments and changing social norms, strengthening economic opportunity, and ensuring healthy child and youth development. And the idea here is really to be able to communicate about the primary prevention of violence and to help improve public understanding and support for prevention strategies. So each template will have a similar structure, and will have some sample language for different types of prevention strategies that are relevant to that topic area. So for example, for strengthening economic opportunity, there will be examples of how to frame affordable housing, paid family leave, paid sick days, and child care subsidies, and why these are important to prevent violence. Okay, I think that wraps it up for us.
Thank you.
Thank you, Enrica and Elena. It's really great to hear about how a lot of the work that's happening through RPE and Essentials for Childhood, and also Delta Impact, are super connected and reinforced. The examples of how you all have leveraged your work and connected across your health department divisions is really inspiring, and just proof that it can happen. So I really appreciate all of those examples that you shared. I'd love to invite Alejandra and Sarah into this conversation too, because I know that you both are playing significant roles as part of California's action plan to prevent multiple forms of violence. And so I'd love, Alejandra and Sarah, if you would talk a little bit about what that looks like for you all.
Absolutely. Thank you so much. Thank you for having us. We're really excited to be here, also with our CDPH partners and Pennsylvania. We've got, the partnership has this tagline of "Together we are stronger," and we really are stronger together. We see this through our efforts. The partnership, we go by the partnership because it's our name's really long, California Partnership to End Domestic Violence, but we are the Domestic Violence Coalition of California. So you'll hear us say the partnership, which gets really interesting when you're talking about collaborative partnerships with the partnership. We work very closely with CalCASA, and CalCASA works very closely with the partnership across various efforts. One of these efforts that we're really proud to share is working together to educate, inform, and request or demand funding for prevention. Ongoing funding is a huge need in our state. We are ginormous, and we need to invest in prevention. So together, the two coalitions developed this campaign, Prevention Works, and you saw it show up as our policy team and our prevention teams were coming together to educate and inform. As we were working on bringing together a policy day and denim day, along with the advocating for this funding and educating our funders and our legislators about what prevention is, we knew that it made more sense for us to work together on this. You'll see on one of our Prevention Across California logos or images, we've got these dots which kind of connect to the connecting the dots idea that several of us have already discussed. It's important for us to build and strengthen those networks, not just across the coalitions, but across the organizations that do the work. We know that there are a lot of preventionists that are working in isolation, preventionists that might not have access to anyone else in their community that they can run ideas off of or work with. So working together across our states is what we do. So we're going to walk you through a little bit more of what that looks like. Sarah.
So, sorry, I didn't know if you wanted to start off with the talking about Delta impact. I will talk briefly about some of the collaborative training and technical assistance that we do. So as Ashley and Tori mentioned, I coordinate our RPE program at Cal CASA. And so a lot of what we do in the RPE team at Cal CASA is provide the training and technical assistance. So we're needing to identify training topics, make our training plan for the year, and that data or how topics are selected just don't come out of thin air, right? We want really good data and information to inform how we're going to make our training and technical assistance plan. And a huge part of that is working in our collaborative to identify field trends, things like that. Also, the collaborative survey and surveying the field, asking folks, of course, who are implementing the programs directly what they need training on, and also making sure that we're providing support on topics related to the goals of the state action plan. So that's how that all kind of is intersecting with the collaborative training and technical assistance that we do. The RPE team at Cal CASA is really small. There's only a couple of us at Cal CASA that work on providing the training and technical assistance. And I think whenever you have a small group, it's so important to bring in outside perspectives and lenses, right? Because we're all kind of subject to our own internal lens or our own biases, things like that. So as we're broadening and talking with more folks in our state who are doing work that's aligned with ours, I think it's really essential to work together in determining topics around training and technical assistance for the field. The other thing that we do is between Cal CASA and the partnership is we make sure that we're sharing our calendars. I can't tell you in the past how many times we have had a communication breakdown and we've scheduled events that are occurring on the same day, which is a huge mess, right? Because we provide TTA to a lot of the same folks. And then those folks are then in a position to kind of choose which one they have to go to. And then it looks like we don't talk to each other, which we weren't. So now we've gotten a lot better at that, making sure that not only are we, ensuring that we're not having things like literally occurring at the same time, but also, in addition to not wanting to work in silos, we also don't want to duplicate effort. So we coordinate on that front as well, which I think is really important. We do have a series. We are just starting next month. We are doing collaborative communities of practice, co-facilitated by Cal CASA staff members and the partnership. All of our prevention folks are working to open up and hold and facilitate this space on 7 different topic areas that, again, we were selected by identifying trends together in the field. And so we're really excited to have that coming up as part of our collaboration and something that we're doing together on the collaborative training and technical assistance front. So Alejandra, back to you.
Thank you. And I'll talk about the next one. Next slide, please. So Sarah just mentioned a bit of what we are doing, and it's important to look back at how we got here. We work together closely because we also have organizations who are dual, right? Domestic violence, sexual violence, rape crisis centers, human trafficking across our state. And so it was important for us to find out what is happening in the field and be able to respond to those needs. So in February of 2019, we developed this statewide prevention assessment in partnership with CDPH and Cal CASA. We got together and looked at what Enrica was talking about earlier, right? What the survey, what are the needs, who's doing prevention, what are the challenges that they're facing, the barriers? And we reached out to 163 organizations and 74 of them responded. from those 74 results, we were able to implement some of those action items or steps into our state action plan. Next. What did we hear back from folks? So we heard that there are some training needs that relate to the items that Enrica was mentioning on the 3 state action plan. So engaging boys and men, restorative and transformative work. Folks want to know about these laws. So I'm happy to share Krista, our policy director, is on today and is doing beautiful work of ensuring that folks have access to information about props, about the propositions, about the bills that are coming up, and making sure that people can attend the policy meetings and learn about what is happening across the state in a way that is easy to understand and accessible to folks. Strengthening economic supports, we're going to talk with the Work and Family Coalition, leadership opportunities for girls, school and campus policies, safer communities, prevention in sports, and culturally responsive prevention. These are the needs across our state, which are helping inform the steps that we take. Now, what are the barriers? These are going to be a total shock to you all. I know this. Not enough staff, lack of funding, there's not enough time, staff retention and transitions, and inadequate prevention training for staff. So in addition to responding to the training needs on the programmatic side and the knowledge need there, we also need to work with our funders and statewide partners on responding to the barriers. So working on also training around how do you manage a project and how do you manage multiple projects at the same time. These training components are going to be included in the communities of practice and across everything that we do. Building logic models, developing activities that align with some milestones and some dates to help folks be able to manage their time better. Lack of funding, we already spoke about that. We have our joint effort, Prevention Works, educating and informing stakeholders on the need for prevention and really, or prevention funding, and really understanding what prevention means. I love that Jenya, our community partner, says, we use these terms, we use this language that tends to only make sense to us. So how can we adjust our language to ensure that it's making sense to our partners as well? The staff retention, we are working, the Delta Impact folks, if you are here, woo-woo, we are working nationally on developing an accountability plan for all of us and for each other on what are we doing to retain staff? What are we doing to support the professional development of staff? We hear from folks who say that, why invest in a preventionist if they're going to leave in 2 years? What if they didn't leave? What if they felt supported and encouraged to stay because we're actually paying them what they deserve based on what they do, and they would stick around? And prevention training for staff, we know that this is a huge need. How do you onboard a preventionist? What does that look like? So we're working across our state with our funders and our statewide partners and our member orgs, our organizations, DV and SV, to develop the next steps. Next. We are definitely responding collaboratively and working together on these efforts, as Sarah mentioned. These are the 7 communities of practice that start next month. And we are so happy to share that with the support of CDC funding, we're going to be able to add one more. We have a new staff member at the partnership as well that's going to help. Where you're going to lead a community of practice for prevention supervisors. How do you onboard? How do you supervise? How do you support a preventionist? And especially in cases, again, where the prevention supervisor might not be an expert in prevention. What does that look like? And then the 7 communities of practice, we're going to be working together, the 7 listed here. We're going to be working together on some joint efforts. Evaluation, responding to the current needs of COVID and racial and economic injustices that occur, and bringing speakers in to educate and inform folks. And This picture here, we also support each other's statewide events. We show up to each other's events. We present together. In this picture, you have CalCASA, CDPH, and partnership staff presenting on integration of prevention. How do you integrate prevention across an organization? How do you make it a core service area? So we definitely are putting in the work to educate, inform, and strengthen prevention collaboratively and collectively. Our state action plan, so our state action plan is a result of the data that we have received from the prevention assessment, feedback from organizations, feedback from folks that are showing up to the trainings and engaging in all of these training and technical assistance opportunities. I'm happy to say that from last year, our leadership team is now so much stronger. You heard from folks that one of the barriers is we don't have enough funding in prevention. So guess who we invited to our leadership team? Funders. We have funders on our leadership team that are engaged in understanding and hearing and are responding to the needs. So it's exciting. We're just missing one funder, and we're going to work on that this year. That is engaged in some of these collaborative efforts. And an item that we are adding, which is responsive to the community needs right now and the challenges that we are all facing, is the strength and intersectional framework around racial justice and preventing intimate partner violence, sexual violence, and teen dating violence. We were genuinely shocked that preventionists were telling us that their organizations do not always understand what intersectional means and why it's important for us to center on racial and economic justice and the impact that has on preventing violence. So we have held a series of workshops, virtual discussions that center around this work and are integrating this into our state action plan. It is very much alive and kicking because it needs to be responsive to the active needs of our community and engage folks in our state action plan. So yes, all of the slides will be shared. And if you have any questions about how we went about the survey, please reach out. That is available for us to share. We want to make sure that folks have access to that.
Alejandra, so speaking of economic justice, we heard Enrica and Elena also talk about their work around, looking at strengthening economic supports. And we know that strengthening economic supports is a cross-cutting strategy to be able to prevent multiple forms of violence. And I know from previous conversations with you that you've built a really strong partnership with the California Work and Family Coalition as part of the partnership's efforts to work on economic justice and strengthening support. So I'd love to also bring Jenya into this conversation and hear from both of you on how you've been able to engage each other in your respective work around this issue.
Yes, as Jenya is unmuting, just want to share that the two coalitions, the partnership and the Work and Family Coalition, have worked together for a very long time. On this effort, we are focusing on preventing intimate partner violence, sexual violence, teen dating violence across our state by educating each other, educating the Work and Family Coalition members and the partnership on our joint efforts. In 30 seconds, the story of if you were to ask me 3 years ago that why would we be centering on paid family leave, I would say it just makes no sense. And we're hearing the stories of folks dealing with financial stress now more than ever, dealing with the challenges that it poses on your family, the risk that increases for relationship stress and relationship violence is huge. So it makes perfect sense for us to be working together. And when you start hearing the stories of our partners, it's all interconnected. Everyone is dealing with the same issues right now. So it was just such a beautiful unison across the two. Jenya?
Mm-hmm. Thank you. Yeah, like Alejandra said, the California Work and Family Coalition and the California Partnership to End Domestic Violence have been connected a little bit through legislation, but in the last few years, this partnership has opened up, my eyes and really connected our coalition more to the bigger picture of DV prevention, and not, whereas before we were a little bit more focused on supporting each other's legislation, working on legislation that impacted survivors, working on legislation that impacts everybody, like paid leave. And just for a little bit of information about the coalition, we're a statewide alliance of a lot of groups. The Partnership to End Domestic Violence is one of them, and really pretty diverse organizations, unions, worker centers, health agencies, health organizations, mother, parent groups, caregiver groups, disability rights, LGBTQ, Black Worker Center, just a lot of, you can see those are the old days when we would stand that close together and put our fists in the air, and it was a really great time. And I really miss that, I have to say. But we came together around the first campaign to pass paid leave, the first successful campaign in the country. California passed the first law. Now we have about 9 states that have it. We really need to have a national universal law where it would be a basic right to take time to care for yourself, to bond with a new child, or to care for a seriously ill family member, should be a basic right. But it has been a kind of an uphill battle. But we're really, with this project, the piece that we're working on more is the reality that this law has been in the books for, over 14 years. And yet even a recent study came out that low-income mothers were not accessing it, even with a law in San Francisco that makes it full pay, which they thought, okay, well, that will really help. That's one of the barriers. But a big barrier is really not knowing your rights and not knowing, exactly how to access them. So you can go to the next slide. We'll talk a little bit about the partnership in this context, because one of the things that we've learned in working on paid leave all these years and working on education around it is that this is something that just impacts everybody. We're working with people who all across the state who are working on other issues, but everybody really needs that time, or their workers need time to be able to bond and care. So it's definitely something that people need. And when we do trainings, which this year with the partnership, we had a pretty ambitious plan. It's kind of like if you were in a band and you went on the road. We were going to be doing large, and we do large trainings in Spanish and English, where we literally switch off and everybody has the headphones. And we were going to do one in LA, one in Fresno, one in Concord, which is in Contra Costa County up in Northern California. And of course, COVID-19 was still just starting the shelter in place just started. So we moved them to online, and it was still ambitious because we ended up doing 6 trainings because we didn't know exactly doing the interpretation for the one training was a little hard. So we moved them. But it was a really good collaboration, and you can go to the next slide. I'm just going to talk about the trainings and what came out of them. Everything that we do, I'm really happy here to hear about all the coalition building, because for us, the whole idea of paid leave and really having equitable paid leave means that you really have to have a lot of partners at the table, because if it's just one organization, they're not necessarily connecting out to where the barriers are for different people. Now, this isn't the whole coalition. This is literally the people who actually did the training. So we really had a pretty broad coalition helping us get the message out. These were our Maria Elena Durazzo, who's a great senator from LA, actually opened it up and welcomed people. We are working with policymakers more and more on the education piece. So we're not just asking them to pass new legislation, but to partner with us in making sure that their community knows. And for Latino, new immigrant, and undocumented workers, the barriers are even bigger in LA area. So she's been a great partner in really wanting to make a difference there. Okay, so next slide. These are just the titles of our 3 different trainings, because it's so unfortunately complex in California. When you literally go to take paid leave, you're covered sometimes by multiple laws, one that gives you the money, one that gives you the right to take this time without being terminated, basically. So we also introduced a lot of the new laws that may be temporary or may be extended into next year, because unfortunately COVID-19 doesn't seem to be going away anytime soon. So there were a lot of federal laws that we had to talk about if people need that time right away. Next slide. One of the things that we did in these is really helping people learn how to access it and how to apply. And that's something we're going to be working on with some of the members of DV prevention groups across the state, is if they want to be, not just have that quick information, but really help others apply and access the benefit. We have the goal of doing some deeper training and support so people can be just kind of a resource in their workplace and in their community. So we had 754 attendees, and we had 99 Spanish, which is actually something that we're really working on. Is when you do something in Spanish, just doing it in Spanish isn't enough. You have to really start reaching out and being sure that you're connected to organizations that have primarily Spanish speakers. This next year, we're also going to be trying to do the same with Chinese communities by putting things in Cantonese and Mandarin, but also, doing that work. So that's, one of the things, language justice is really important to us to be able to really get this out to different communities. But like I said, it just takes that work of, if you translated a bunch of posters and they were just sitting in your office, but you don't have any addresses to get them to, you have to build the relationships. And even more important, I think, is developing that with the organizations. For example, we're working with an organization in LA that works on Black maternal and infant health. And it's not a different language, but we want to develop things that look the way, have the pictures they want, that are the wording they want. It just really has to be tailored sometimes if you're really reaching a community, especially one that is having a lot of barriers around both healthcare and paid leave and all of these different benefits. You really need to develop it with them, not just go, hey, we developed this thing here. So that is a coalition that's just really important to us. So this is just some more facts about the trainings that we were very proud of. And we're just continuing to put this information online. In addition to the detailed trainings, we're working with our comms director, who's very good at getting snappy information out there. One of the things that she's done is introduced us to a whole world of breaking out of even just you're in a nonprofit, you're in an organization, but to new moms, new parent groups, a lot of people that are just struggling to get this information. And she's been just great at getting stuff online, Instagram lives, all of the different ways. And that's something we'll do more of next year. So these are just some nice compliments about our training. So Alejandra, I really like the Spanish one because I think she's saying that the people who did the training were very smart. That's the gist that I get out of it. So, who doesn't like a compliment? But we're just really proud of this effort with Alejandra and the partnership and all of our different partners this year. We learned a lot from it. We'd probably do some things differently. Like, we're really trying to concise it up and give people bite-sized pieces of information. But it's just an ongoing effort. And I think we're going to make a huge breakthrough in the next couple of years, especially as part of this project, with just getting this information out to people who need it. So I just really appreciate being part of this. I think it's really one of the key building blocks to just having some economic security and just having more justice, is people being able to access time off when they need it. And it should be everybody. It shouldn't be the top, not even 1%, but literally people that make 90,000 plus are taking it a lot more than anybody else. That's not the 1%, but it's higher earners than we have a lot of in California. So I really appreciate this. Thank you very much. And next slide, I think I'm done. I don't know if I threw one more thing in. Okay, good, yeah.
You're good. Thank you so much, Jenya and Alejandra and Sarah for sharing about all of the collaborative work that you're doing. And I did post a link in the text chat because we've had Alejandra and Jenya on a previous web conference talking a little bit, a deeper dive into some of the work that they are collaborating around on paid family leave. So if you're interested in hearing more about that, I really encourage you to check that web conference out. But Daniel, one thing that I really appreciated about what you shared. I mean, I appreciated everything, but we certainly have all had to make a lot of adaptations to the way that we are doing our work and thinking about our work. And so I'm wondering from you all in the audience, how have you adapted in order to communicate and engage with your stakeholders and partners during the pandemic? Like, what does that look like? Have you still remained in communication? I feel like this is one of those perfect times where things just kind of break down. And so I'm just wondering, what things have you learned? What adaptations have you been able to make in the way you communicate and engage with your partners? So we'd love to hear from you all. And while we see what you all are thinking, I'm going to pass it over to Tori so we can hear from our friends in Pennsylvania.
Thanks, Ashley, and thank you to the California team for giving us so much great wisdom about how you all are engaging in this work. Kristen and Jackie, I am so excited to pass the mic over to you all, and we're going to hear more from the California team in a little bit too. But first, Kristen, we'd love to hear more about the Delta Impact State Action Plan. Can you share about how you approached that process and who you brought on board as partners?
Sure, absolutely. Can you hear me okay?
Yes, I can hear you.
Awesome. Thank you. I apologize in advance for any barking. We're having a thunderstorm and my dogs are really scared. So I've done the proper parenting, trauma-informed technique and locked them out of the office. So I apologize in advance. So thank you, everyone. Thank you, California. I know I certainly learned a lot from your presentation. Thank you, everyone, for having us here today. Thank you, Benson, for sharing your input in the background. So Pennsylvania is a membership-based coalition. We act as a pass-through funder in our state, just for some background. There was supposed to be a picture of our prevention team here so I could show you and make a joke about how I like Diet Coke so much. They actually bought me a case for my birthday, and that was a picture of us celebrating my birthday with Diet Coke. So in domestic violence prevention land in Pennsylvania, prevention is funded consistently at the coalition level, but not at the local level. And it is not considered a core strategy according to our membership standards. So I say all this just to share some background about us, to be transparent that we still have plenty of work to do in Pennsylvania, but also to say that you can still build a successful and collaborative team, even if your agency still has some work to do internally. Next slide. So this is a vision statement from our leadership team. So our leadership team is a bit younger and smaller than California's. We've been meeting for over 2 years. We have members from rural communities, schools, local programs, the banking center, secondary education, our sister coalition against rape, state data center, government departments, and then immigrant and refugee network, SOL requirements, and trans advocacy PA, to name a few. So the vision statement that you see here is a result of our collaborative work together. And so for our presentation, because we're a little bit sooner in the process, we're going to focus more on how we drafted the plan and built the team in order to do that. Next slide. So what we did was we took a look when we were asked, we're new to Delta funding land. We had PrEP a few years ago, but as a coalition, we haven't had anything prior or since. So having a state action plan was something that we had, but it wasn't sort of a continual part of our process, if that makes sense. So the very first thing that we did was we actually pushed back at our funders and said, listen, if you want us to do this and you want it to truly be collaborative, we need more time. And we actually were able to get a time extension. So that was sort of one tip that helped us. So when we think about what was important elements for us in bringing on folks and keeping folks engaged in a group like this are the following topics. So bringing them on as partners, getting them on the same page, building team dynamics, structuring the meeting, and then getting to action. So how did we actually draft the plan itself? Next slide. Okay, so when you're considering who to bring on, look at your low-hanging fruit. Who do you have relationships with? Who can those folks bring to the table? What about other folks in your organization, even if they're not doing prevention? Who do they have partnerships? And then also acknowledging that maybe that doesn't cover everyone you want, or that low-hanging fruit, the folks that you're already partnered with, might not be representative of the communities that you hope to and intend to serve. So you want to continue to do some more outreach. What worked for us is bringing on partners. So this is a emoji depiction of me cold calling someone, or just even calling. This could also be me calling my mom, probably. I don't like doing it. I don't like phone calls. They scare me. So work with someone on your team or someone else in your organization and try and come up with an approach that works for you. For us, it was a combination of emails and then someone following up with a phone call. And that seemed to work for us. What was also important that we very quickly found out was that we needed to have very specific information before we reached out to people and asked them to commit their time and their resources to this work. So some of the things that we felt were good to have when we reached out, or that we learned were good to have, were: when will you be meeting? Where will you be meeting? How long are you going to be meeting for? What are their responsibilities as participants in the group versus yours? What are the goals, or at least the goals as they stand now? Of course, that's flexible. And then what's in it for them? Why do you need them? So this is a time and resource commitment for our stakeholders, as it is for ourselves. There are plenty of meetings that we all end up in, and some of them duplicate. So really put some thought into what the purpose of this group is. And then make a conscious effort to ensure representation from underrepresented communities and the organizations that serve those communities. And for us, it's important, and it's been important, to pay those folks for their expertise and time. It's both important to the work that they are at the table, and it's also part of the work itself to promote their voices, to bring up existing leadership, and to compensate and value their work. Next slide, please. Okay, so because we want to do intersectionality, we have to bring on some non-traditional partners or folks that haven't necessarily been working in the DVSA prevention field. And so one of the best ways for us to bring folks all on the same page, so to speak, was to train them on the Thrive model from Prevention Institute. It's helpful in connecting folks to our work, especially like a lot of what California was talking about, the pay equity. It's helped us make connections to our banking folks. It's also helpful to introduce to them or reinforce for them how oppressions and structural disadvantages are related to and likely causal factors of domestic violence. So in one way, it's sort of an education and a reinforcing tool that this is where we stand on this issue. We also work to develop mission and vision statements as the groups in California, and we worked on the collaboration multiplier that was shared at the beginning of the presentation. Next slide. Okay, the collaborative multiplier is a fantastic, just shy of 300 pages, very brief read. So if you have about 5 minutes of spare time, I'm sure you could get through it. I delegated that to somebody, but it's a really great tool. If you don't have a team yet, you're not sure to start, where should I start? It's a great foundational tool. It's also, if you have a team and you're looking for different tools to use throughout, a really great document also. So we used very specifically pages 38 and 39 and shared them with folks to get them to think, to get us to think about what they could bring to the table. So the tangible examples that California shared, those weren't just training and evaluation data collection. Those were sort of unique approaches, different resources that folks could bring to the table. And doing this after the Thrive model, because the Thrive model presents sort of non-traditional approaches to the work, really helps folks to think outside the box when they answer those questions. Next slide. Okay, breaks. Breaks are very important during meetings. This is where we're just talking about tangibly having actual meetings. So it was very important to us, it is very important to us to build our dynamics as a team, especially since when we talk about intersectionality and anti-oppression, we're going to be talking about things that are difficult and things that don't require us just to bring our professional selves to the table, but also require us to bring our personal selves to the table. And so all of us, I want that cartoon meeting face too, sorry. So all of us strive to get to know one another outside of just what we do. So when we talk about breaks, we like to do icebreakers, opening, check-ins, that sorts of thing. Team builders are really good. And then we like to throw in some what we call creative breaks, which is 5 to 10 minutes where you do an activity that has absolutely nothing to do with anything. So we'll do origami, or we'll go on a scavenger hunt, or we'll do some sort of weird game, charade, something with each other that's completely unrelated, to take some space and have some time to take a bit of mental break from the work. And then also, the other thing that's been really important for us in building team dynamics is making it comfortable for folks to share feedback. So if folks can't share feedback with us, then what is the purpose in our minds of having a collective group? And if we can't hold one another accountable in different ways, then are we truly doing the work? So for us and for myself, it's been really important to demonstrate giving and receiving and being accountable to feedback, and some different ways, strategies that have worked, I went ahead and put up there. One of the things that I want to call out is being transparent about your decision-making process. It's really helpful for folks to know and feel that they can share feedback if they have a full perspective of what is going on. Okay, next slide. Okay, structuring the meetings, making the meetings fun and actionable. We go to lots of meetings. Some of us might enjoy that many meetings. Most people don't. And especially when you're getting a group together once every so often for a block of time. Me personally, our group, I like to make sure that it's actionable, but also something that folks look forward to going to, that folks want to participate in. So when you think about how to structure the meeting, timing is important. So we don't meet for more than 3 hours. And that is including lunch and breaks. We meet once every other month. So again, this is what works for us. Definitely get your group's input to decide what works best for them. Breaks, we talked about this, writing an agenda. So the importance of folks knowing in advance what you're going to talk about. It's hard for people to process, some people in the moment, if we're asking for feedback or doing an activity. If you prep them the meeting before, let them have input on the agenda, that's great. And then open the next meeting with, this is our agenda for today. This is how we plan on doing this activity or these activities. Does anybody have any feedback? Food and the working lunch. If you can feed people, it's helpful, it is an incentive, and it's community building. I mean, we know that. So where we've been able to pay for lunch with different funding streams is if it's a working lunch, and if while it's a working lunch, it is inaccessible for folks to go out and access food because there are time constraints, which is also another incentive to keep meetings short, because you can't give an hour to go get lunch if you only have a 3-hour meeting. And if there's no food nearby. So really, if you can't walk or wheel somewhere, to get different types of food, then it's inaccessible. And we really use that to purchase food for our group. And then virtual considerations, I think we'll talk about this more at the end, but consider shortening, consider some different activities, allowing folks to be unmuted so they can participate however and whenever they choose. And then next slide, sorry. So how we just started was we put together an outline based on our previous plan, based on other coalitions' plan, and we shared it with the group, and we just sort of started there in a feedback process and drafting things and asking them for feedback and editing it, et cetera. And then continuing to draft while we are training and learning and growing as a team. So not sort of taking breaks and then doing the work, but really making sure we're doing it at the same time. And now I will pass it over to Jackie, who's our partner with the Pennsylvania Coalition Against Rape.
Thanks so much. So we at PCAR, mostly it's just me at the coalition as far as prevention goes. So I feel very fortunate to get to work with PCADV and some of my colleagues at the NSVRC. And so when we were creating our RPE state action plan, we only had 3 months, like many of you, to turn in the draft plan. We were feeling very scrambled. And I believe we had another 4 months to submit our final plans. So we decided to do what would be as easy as possible, which was to utilize a group that had already existed, which was the Sexual Violence Primary Prevention Committee. You can see some of the people that were on that committee. Mostly we wrote the plan and sent it to folks for edits and feedback, but we wanted to do something more, and it just so happened that PCADV was working on creating the state leadership team at the same time. The next slide. And so because they invited us to take part and we had some of the same people on that team, we figured why not just work together? And so it's been so tremendously helpful to be part of the state leadership team. We really get to meet and interact with so many different people that we wouldn't normally get to. Like Kristen and her team have done such a great job running the meetings. The food definitely helps as someone who goes, the breaks help. I really look forward to it. And we've really developed some personal relationships with the people where we don't just talk about work. And I think that really makes it helpful for us to want to actually go to these meetings every 2 months. And even when we had to do them online through COVID, people were still very friendly and wanted to genuinely hear about how others were doing. So we're excited to keep connecting with the state leadership team, and that's where we're kind of putting our focus right now. So next slide. We got some feedback from our coalition, we got some feedback from some of the rape crisis centers and domestic violence centers that we share that are dual programs. And they said, hey, we already do some stuff separate. Can you make it easier for us around prevention and really work together? And so we decided that we were going to find a way to make that happen. So we put a joint statement in both of our plans to do that, which is part of it is here. And then we also decided that we were going to more jointly work together around our annual prevention summit that we have every year. We wanted to keep collaborating on the state leadership team and other initiatives like our COVID-19 state task force. And then we also connect more frequently now about shared training and TA requests, which has really helped during the pandemic figure out ways that we're not duplicating efforts. I think the California team said before, we share calendars now. We make sure that we're coordinated better because we had similar things happen to us as well. And so even though our strategies are a bit different, where we're really funding rape crisis centers at the local level and PCADV is working more at the state level, we're all committed to the same thing, so we might as well keep working together. So the next slide just really gives you a brief overview of how we've done the Prevention Summit. It started out doing them separately, and over the years, we've really been able to host them jointly and even share in the costs. And so the next slide really just shows you, we were so excited to do our 2020 summit, but it had to be postponed due to COVID. And what's been great about that is that we really learned what the needs of all of the centers were, and they really want us to go more in depth. They want us to talk about anti-oppression, and they want to network and hear from one another. So one of the ways that we did this, if you go to the next slide, is last week we actually had one of our first joint webinars, I guess, where we talked about how anti-oppression is prevention, and we framed it as the social ecological model and really wanted to give tangible action steps that folks could take to integrate anti-oppression into all of the work that they do. And so this is one of the first ways that we're going to be having this conversation. And I think that leads us into our final conversation and question here about racial justice.
Yeah, thank you so much, Jackie and Kristen. Before we get to this question and hear from you all around this, I just wanted to, I think that the tips, Kristen, that you shared around how to engage people are so important, because we all are being invited to so many meetings, whether we're scheduling them from our end or we're being invited. Those things make a really big difference. And especially right now, folks are dealing with so many things virtually. And so really thinking about the experience. And I think it really comes down to just a mutual respect, right? Respecting each other's time, respecting each other's work, and what we bring to the table. So really appreciate that. And Jackie, thank you so much for sharing and leading us into the fact that we know that racial justice and anti-oppression, for a lot of prevention work happening, that's really the core, right? And so when we're talking about coalition building and action planning, we also have to be making sure that racial justice and an anti-oppression framework is really foundational to our work. And so a question for everyone in the audience is, how are you ensuring that racial justice and anti-oppression is foundational to the coalitions that you're building, to the partnerships you're developing? And I know that we don't have a lot of time, and I hate that, but I'd love to move and hear from our teams on this question. So I am going to pass it back over to you all and hear about how you're really looking at accountability and shared analysis.
This is Alejandra from the partnership. Several folks have seen our statement that we released, standing in solidarity with Black Lives Matter. And we had to go beyond solidarity. It is also a statement of collaborative accountability and a statement of self-introspection. It is inviting all of us, the staff at the coalition, to dig deep at the way in which the disparities are showing up across our field, how the DV orgs, rape crisis centers, have caused harm, and it's hard to say, and we need to address that and respond to it collectively. We're also doing that at the national level with some of our partners, and providing a space for role modeling that to also the organizations across the state on what does that look like? Because we can't just talk about accountability. We have to show it. We have to show what that means and what it looks like. And we have to be okay with the discomfort that's going to come from it.
And this is Elena, and I just really agree with everything that Alejandra said, and just would like to emphasize that it's really important to lean into the guidance that comes from collaboration with stakeholders and the various task force and groups that we're all a part of. And I don't think I explicitly said it, but Alejandra leads one of the subcommittees. Certainly we engage in those spaces, and I really rely on her and the collective body to share where there are needs and point out where there are opportunities to do better, and really appreciate and grateful for the opportunity to learn alongside folks. But we can't do that in a silo, and that's why it's just really important that those collaborations are highlighted and we hear and listen and have the opportunity to do better.
Yeah, so for us here in, for us here in PA, we had, like I said previously, had conversations with our coalition staff about the importance of having an anti-oppression framework in all of the prevention work that we do. But Kristen did a great job really making sure that everyone on the state leadership team was trained in intersectionality, anti-oppression, and equity. And I think she wanted to share more about that.
Oh, sure. So thanks, Jackie, and thank you, everyone from California, for everything that you've shared so far. Practically, how we've incorporated this with our leadership team is in membership, so making a conscious and intentional effort to continually look at our membership and make sure it's representative. In our planning process, so collectively learning, continuing to learn and act at the same time. And then in our plan, making sure that it is actually physically written down in our plan that anti-oppression, anti-racism work is necessary to the movement and is violence prevention.
Thanks, Jackie and Kristen. Heidi was wondering where the wheel image on that slide is from. I don't know if you have a source for that you can share in the text chat.
I will share. Yes, I will.
Thank you. Enrica, what about from the California RPE side? I know you all are using the social determinants of health framework in your work. Will you talk about that for a moment?
Sure. Just really quick, there's a graphic up here. This is the framework that's been developed by the Bay Area Regional Health Inequities Initiative. Our department has adopted this framework to consider these, social and institutional inequities, which you see on the left of this graphic right here. So that's what we're trying to dig deeper in addressing this in the RPE program. And I would have to say that this is definitely a work in progress for us and an area to improve. But I just wanted to share that there is a framework out there. I can add to the chat the link for that.
Awesome. Thank you so much, Enrica. And then going back to you, Alejandra, I know that the Delta Impact work out of California is also really looking at racial justice in terms of your economic support work. Can you talk about that for a minute?
Yeah, I mean, I think it's a reminder and an invitation to all of us to acknowledge and center on the margins of the margins. What does that mean? What does it look like? Who does not have access? What does access mean? And challenge ourselves in developing tools and resources that respond to those needs. So internally at the partnership, we're looking at, again, economic justice. What does that look like across our field? How many folks are still making $16, $17 an hour and are asked to have master's level and all of this other stuff in our field? And we're speaking loudly about economic justice. That's not okay. Like we got to hold ourselves accountable. And when working on the economic justice piece with our partners, Work and Family Coalition is also looking at the needs of Black communities, Black lives, Black workers, immigrant workers. Folks don't always have access to these benefits. Right now with COVID, we talk about unemployment. Unemployment is not accessible to undocumented immigrants. We talk about paid family leave. Most of the systems are in English, and I have a master's and can't understand it. So we have to challenge these systems and ensure that they are set up for all. And what does that mean? And Jenya and the advocacy team do a beautiful job of challenging our legislators so that we do center on the most marginalized and work collectively on that.
Awesome. Thank you so much, Alejandra. You will have access to this text chat in the coming days, and most of the links should also be on the slides, but we will make sure that you get a copy of the text chat. So, gosh, 90 minutes goes by really quickly. We've actually gone 2 minutes over, so apologies to you all, and thank you for sticking with us. I just, there's such a rich conversation and so many amazing lessons learned. And so just, thankful for all of our guests today. Grateful for you all that joined us. Really appreciate you being in community with us. We will have a recording of this web conference available probably some point next week, and you will receive an email when that is available along with the text chat. We'll also go ahead, because there were a lot of links shared in the text chat, we'll go ahead and compile a list just of those resources, and we'll include that in our follow-up email to you. So I wanted to just thank you all again so much for joining us today, and we hope to see you on a future PreventConnect web conference. We do have one next week, actually, around how to talk about economic supports and how strengthening economic supports can actually prevent sexual and intimate partner violence. So we hope you'll join us for that. Thank you all. Be well. And like I said, I hope to see you again on a future web conference. This will conclude our session for today. Take care.